This module will provide a refresher on the Combitube SA dual lumen airway. Participants must take all 3 units, pass each unit quiz, and successfully complete the final exam with a score 85% or better in order to get credit for the course. Once completed, this course is worth a half contact hour for CME. Course objectives for the Combitube SA refresher training. First, we'll provide a review of the Combitube SA airway. We'll talk about key components. We'll describe the use of the Combitube SA airway, how it's inserted, how we determine which of the 2 tubes to ventilate from. We'll talk about airway management and maintenance related to the Combitube SA airway and provide some tips for troubleshooting. Finally, we'll identify clinical indications for the use of the Combitube SA airway, and we'll describe some key components of the quality improvement program. The first section was the Combitube SA airway review. The Combitube SA airway is a dual lumen supraglottic device. It's designed to be inserted blindly without visualization of the glottic opening. This is key in situations like cardiac arrest, where we want to minimize the stop in CPR. Typically, the airway seats in the esophagus about 80% of the time, greater than that if we have good head positioning. If the airway is inserted tracheally, the number 2 tube can be used in similar fashion to a standard endotracheal tube. Some features of the Combitube SA airway. Tube number 1, the blue tube, is an esophageal obturator type airway. It provides air pressure over the glottic opening and air moving into the trachea and inflating the lungs. Tube number 2, the white tube, is designed to act as a standard tracheal tube airway in case the airway is not placed in the esophagus. It does have a low pressure oropharyngeal cuff at the top and a higher pressure esophageal cuff towards the bottom. If it's placed in the esophagus and ventilated through tube number 1, the second lumen can be utilized for suctioning. Once the airway is placed and has been confirmed, a Thomas tube holder should be used to secure the device. If it's inserted in the esophagus, the Combitube's inflatable cuff seals off the oropharynx proximally and the esophagus distally. This seals the structures and allows the air from the obturator tube to enter into that glottic opening, inflating the lungs. If, however, it's inserted in the trachea, the distal cuff will seal as though it were a standard endotracheal tube.